Preparing the infusion. The infusion is prepared in a preparation room specially designated for this purpose and immediately before giving the infusion. Sterile conditions apply. The first step is adequate hand disinfection. Infusion instruments. Pay attention to the labeling when selecting the infusion instruments. Infusion instruments labeled with a P are used with an orange-colored roller clamp for the Aclasta infusion. Disinfection. Now the cap of the infusion bottle can be removed. Puncture. The roller clamp is opened. The specially designed tip of the connection device is inserted at the marked rubber stopper. Do not screw in the tip in order to prevent material rubbing off onto the bottle. The roller clamp is then closed again. The infusion bottle can be hung on the infusion stand. Drip chamber. The drip chamber should be 2/3 full. Deaerating the infusion tube. The tube must be completely deaerated. To do this, open the roller clamp. The tube cap remains on the end of the tube as contamination protection. The infusion is then prepared. Utensils. All the utensils required for the puncture must be available in order to prevent the flow of blood being interrupted for a long time. Applying the tourniquet to the vein. The blood flow to the vein is stopped with a tourniquet. Make sure the injection area is sufficiently illuminated. Give yourself sufficient time to search for a suitable injection site. After you have found a suitable puncture position, the area must be disinfected. The disinfectant should soak in for approximately 15 to 30 seconds. A shorter time is ineffective. Then wipe off the disinfectant with a sterile swab. Vein puncture procedure. Adjust the form of the fixation plate to the anatomy of the puncture site by bending the two wings. Remove the cannula protection by pulling it off. How can I prevent the vein from rolling away? You can pull the skin away from the puncture site in the direction of the flow of the vein. You can pull the skin away from the puncture site sideways by grasping the patient's arm with your hand. Hold the cannula with the thumb and index finger. The middle and ring finger can be used as support. The penetration angles should be roughly 30 to 45 degrees. Now insert the indwelling venous cannula into the vein until you see blood in the blood collecting chamber. Now reduce the angle somewhat and push the indwelling venous cannula approximately 1 centimeter further into the vein. This is to ensure that not only the steel cannula but also the plastic catheter are completely inside the vein. Now withdraw the cannula approximately 1 centimeter from the catheter. The tip of the cannula is therefore within the plastic catheter and cannot injure the vein wall if it is pushed in further. When withdrawing the cannula, blood must flow into the plastic catheter. Now push the indwelling venous catheter in completely. You should not feel any resistance when you push it in. Otherwise, a complication may occur. Then the tourniquet can be loosened. Fixing the indwelling venous catheter. Fix the indwelling venous catheter by means of a suitable adhesive tape. Tape the cannula to the indwelling venous catheter. This prevents blood from escaping and has a stabilizing effect. Setting up the infusion line. The cannula can be removed after stabilizing the catheter. To do this, feel for the tip of the indwelling venous catheter and press it firmly with one finger. This prevents blood escaping from the catheter. With the other hand, remove the cannula and dispose of it in the provided cannula box. Now open the cap of the infusion line with your free hand by pushing it away sideways. The infusion line is now screwed onto the indwelling venous catheter. Now fix the infusion tube to the patient's arm with a loop and adhesive tape. This additional fixation offers protection against the catheter being pulled. Vein puncture. Now insert the butterfly into the vein until you see a small column of blood in the tube. Setting up the infusion line. Now fix the infusion tube to the patient's arm with a loop and an adhesive tape. Setting the drip rate. You can control the drip rate with the rolling clamp. Ending the infusion. Now remove the infusion line by unscrewing it. The cannula is sealed with a sterile sealing cap. Then the fixation can be detached and the indwelling venous catheter can be carefully removed. Press a sterile swab on the puncture point until the bleeding stops. Then a plaster can be applied to the puncture point.